All right, today we are going to be assessing our patient and we are going to be giving her medications and performing a procedure, which our procedure is a Foley catheter. Our patient is Glenda Kronk. She's a 35-year-old female who presented with pneumonia and obesity. She has a history of hypertension and hyperlipidemia. She's expressed to the nursing staff that she has a runny nose, a moderate headache, and some difficulty breathing. She's also had a productive cough. This morning on rounds, she told night shift that she felt some bladder pain and urinary retention, so that is why we will be doing the Foley catheter today. She's a full code, her diet is regular, and she's alert and oriented from our last assessment. Her vital signs are every 4 hours, and last set that they were taken, the blood pressure was 187/92, which is out of the normal range, but she does have hypertension. Her pulse rate was 88, which was within the normal range of 60 to 100. Her O2 sats were 94% on room air, which is above 90, so it is normal. And her temperature was 37.5, which is a little bit high, but not yet a fever. Okay, she has no drug allergies, and let's go and talk to our patient. Hi Glenda, my name is Riley. I'm gonna be your nurse today. How are we feeling today? You feeling okay? A little bit tired? Okay. Well, let's get you taken care of. Today what I'm gonna be doing is I'm gonna be performing an assessment. I'm gonna get you your medications, and then I'm gonna give you a Foley catheter for the urinary retention and discomfort that you're feeling. Does that sound okay? Okay, and if you have any questions, please ask me. I'm gonna walk you through everything, but I just wanna make sure that you're comfortable, okay? And I'm just gonna look at your wristband to verify you are who we say you are. Can you tell me your full name and date of birth? Okay, everything matches what I have. So now what I'm gonna do is I'm just gonna grab this and I'm gonna start my baseline assessment. I'm just gonna perform hand hygiene. Some gloves. And just make sure that we shut the curtain and the door for privacy. Okay, Glenda, the first thing I'm gonna do is I'm just gonna raise the bed up to a comfortable height for me. And I'm gonna sit you up a little bit, that way you're comfortable too. All right. Okay, Glenda, can you tell me how you're feeling today? Just trying to get an idea of what your mood's like. Feeling pretty good? Okay, pretty happy? A little tired? Okay. Can you tell me where we're at today? Yep, we're in the hospital. Do you know what your full name is? You already told me that. Okay, can you tell me who the president is? Perfect, that's right. And then can you tell me why you're here? Right, you're here for pneumonia and obesity, but you also have hypertension. Good, you've got it. Okay, so I am going to start by asking you a little bit about your pain. Are you having any pain today? Yeah, just a little bit of pressure in your bladder, okay. And then anything else? You've got a headache, okay. What would you rate your pain? About a 4, okay. Can you tell me what are the characteristics of your pain? Okay, how about the onset? When did this all start? All right. And then the location you told me is in your bladder and your head. And then about how long does it last? Okay. And then what makes it worse? Getting up and moving? And then does it radiate anywhere else besides those areas? No? Okay. What makes the pain better? Laying down, resting, okay. And then do you have any other side effects that come with it? No? Okay. All right, I'm just gonna begin my assessment then, now that we are all good to go. Now the first thing I'm gonna do is I'm gonna check I'm just gonna feel your facial structures here, make sure there's no abnormalities, and I'm gonna do the same thing with your neck. Okay, everything feels good. Can you smile for me? Raise your eyebrows. Good. Okay, now I'm just gonna check your pupils. Good. Okay. Pupils are equal reactive to light. Pupils are equal around reactive to light and accommodation. So Perla is intact. Everything looks great there. And now Glenda, I'm just gonna look in your ears. Make sure you don't have any drainage or anything. I'm gonna come around and look in this one. Okay, your ears look good. And I'm gonna do the same with your nose. And can you say off for me? All right, everything looks great. Okay, now what I'm gonna do is I am going to inspect your chest, just looking at the skin, making sure there's no like wounds or loss of skin integrity, okay? All right, everything looks good. And now I'm just gonna listen to your heart. And then, do you have any chest pain? A little bit, okay. Yeah, that's what you said earlier. And then how is that? About a 4 or 5 out of 10? Okay. All right. Okay, I'm gonna listen in 5 different spots. This is the aortic, pulmonic, tricuspid, Erb's point, and then the mitral. And this is where I'm gonna listen for 1 minute for PMI. But for right now, everything sounds great. Your heart sounds are normal. And now I'm gonna listen to your lungs. Do you have any difficulty breathing? Any congestion? You do have a cough, a productive cough. Like, how does that feel? It's kind of hard to breathe. Yeah, yeah, you do have pneumonia, so those are common side effects. I'm just gonna listen to your lungs, okay? I'm gonna sit you up a little bit. Okay, can I have you take a big breath for me? In and out. Good. Okay, and I'm gonna do this on 6 spots on the front and 6 on the back. Big breath in and out. Okay, big breath in and out. Perfect. Now I'm gonna lay you down. We're gonna roll right to the side. That way I can listen to your lungs and I can look at your back all at the same time. Okay, and I'm just gonna assess the skin while I'm here. She doesn't have any wounds or lesions or any abnormalities, so everything looks great here. I'll just note that in my skin assessment. Okay, Glenda, 6 spots on the back too. Big breath in. Big breath in and out. Big breath in and out. One more time. In and out. And in and out. Okay. Perfect. You did great. All right. There is a little bit of congestion in the lungs because of the pneumonia, but that is very common. Okay. Let's get you more comfortable again. Okay, Glenda, the next thing I'm going to do is I'm going to assess your abdomen. Have you had any abdominal pain or any problems with bowel movements? No? Can you tell me when your last bowel movement was? Okay, perfect. All right, and I'm just going to look, and I don't see any abnormalities in the skin, no wounds, no nothing. Everything looks great. Okay, Glenda, I'm just going to feel 4 spots, and you're going to tell me if you have any pain or discomfort, okay? Is this feeling okay? Okay. All right, everything looks and feels good. Now I'm just going to listen to your bowel sounds. Okay, and we have bowel sounds in all 4 quadrants. That's great. Glenda, do you have any, you mentioned earlier that you're having some difficulty urinating and you've had a history of urinary retention. Is that bothering you today? Yes? Okay. And then do you feel pain like here in your bladder? Yeah? Okay. All right, sounds good. I will make sure that I document that. And now what I'm gonna have you do is I'm gonna have you squeeze my hands and see how strong you are. Squeeze, 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 good. I'm gonna have you push up on my hands while I push down. Good, I'm gonna have you push down while I push up. Good, nice and strong. I'm just gonna feel your pulses. Pulses are equal bilateral, they're great. And your skin turgor is less than 3, so that looks great. And I'm just gonna feel for any edema or swelling that we might have. And I'm also checking the skin too, just to make sure that we don't have any abnormalities. Okay, I'm just gonna do the same thing on the legs here. Okay, and then I'm just gonna feel for your distal pulses. And they are also equal and bilateral. And then Glenda, can I have you push against my hands? Good, and then can I have you pull my hands towards you? Great. Okay, let's get you all covered back up. All right, everything looks great. And at this point, I would have the patient get up and walk to do the gait assessment. But where this is a mannequin, we can't really do this today. The next thing I'm gonna do is I'm gonna go get your medications ready and I will be back, okay? Are you nice and comfortable while you wait? Okay, perfect. I will see you in just a minute. So now I'm just gonna take off my gloves and perform hand hygiene. I'm just gonna go ahead and get my medications all prepared for my patient. So my patient will be getting Lotessin for hypertension and atorvastatin for high cholesterol today. All right. Okay, and I'm gonna come into my chart and I'm gonna go into my MAR and I can see the atorvastatin calcium here. It is 20 milligrams by mouth and it is scheduled Q 24 hours 1 and it is due today. And the benzopril hydrochloride, 40 milligrams by mouth, is due today, and it is once a day. So I have this is my first check. I have my right medication, I have my right patient, I have my right dose, my right route, my right time, and then I also have my right reasons here on my report. So I'm gonna do my hand hygiene, put on some gloves while I get these medications prepared. Okay, so our atorvastatin calcium is this right here, and our order has 20 milligrams, and each of these little capsules are 10 milligrams. So we will be giving 2 of these today. So it is atorvastatin calcium. Okay, there's 1. And 2. So that is our 20 milligrams of atorvastatin calcium oral pills for Miss Glenda. And then our second medication is benzopril hydrochloride, which is the other name, which is the trade name for Lotessin. And that is what I have on my report paper. And I have my benzopril chloride here on my MAR. And these are 20 milligram tablets. Our order is for 40 milligrams, so we will be getting 2 of these today. Okay, perfect. Now that I have these all put together, I'm gonna take these into my patient. Okay. Hi Glenda, I am back with your medications. And I have you a cup of water here. And then, Glenda, I have your atorvastatin calcium, and I also have your Lotessin for hypertension, which is going to help with that blood pressure, and the atorvastatin is for your cholesterol. Okay. And then can I just have you identify yourself one more time for me? Can you state your name and date of birth? Perfect. That is what I have on here. So I'm going to go to my atorvastatin, and I'm going to scan my patient barcode. Perfect. And now I'm going to scan my medication barcode, which is my atorvastatin. Perfect. And then I have the right dose. And then I have the right route, which is oral, and I have the right time, which is right now. And then this is my second check. This is my third check. And my secondary check is the birthday. Okay. All right. And then, okay, Glenda. And then I'm going to go to my benzopril hydrochloride. I've scanned the patient, and then I'm going to scan the barcode for the medication. I have the right dose, right route, and right time. I've completed my 3 checks and my 6 rights. I've double checked my patient. Okay, and I have your medications and your water here. So here is your meds, and have a sip of water. You got those down okay? Let me see, make sure you swallowed them. Perfect, everything looks great. Okay, and I have those administered and documented that they were given right now. Okay, Glenda, now that I've given you your medications, I'm gonna get prepared and we are gonna start to insert your Foley catheter, okay? So give me just a couple minutes to get all my stuff put together and I will be right back. So now that I have given my medications, I am going to get ready and place the Foley catheter for my patient. Oops. Okay, and the first thing I'm going to do is I'm just gonna write this all down, make sure it's all clean, and I'm gonna gather my supplies, which is my Foley catheter kit, gonna just bring this into the room. Just bring that right there. Perform hand hygiene. And then put on some clean gloves because I'm going to be cleaning the area before I start my sterile technique to get my catheter ready. All right, I have my wipes. Hey Glenda, I'm back. I'm just gonna make sure we have a shut door and curtain. So now what I'm going to do is I am going to clean your peri area, do some peri care before I place your catheter. These are just some wipes, and this is just a cleaning procedure, so we do not need to be sterile right now. But I will walk you through everything I'm doing. If you have any questions, please ask me, okay? I'm just gonna lay down. And I'm gonna raise you up just so it's a comfortable working height for me. Okay. And it looks like we have a Chucks underneath you, which is great. Okay, I'm just gonna place you in dorsal recumbent position, which is like this frog-like. This way I can just clean the area, okay? Okay. And I'm just gonna start by cleaning the labia one side, top to bottom, getting a new side of the wipe each time, top to bottom, and then right down the middle. I'm gonna get a new wipe, and I'm gonna clean each side really good. New side of the wipe. Perfect. Now that we are clean, I am going to prepare my sterile fields and get ready to place this catheter. Are you still doing okay, Glenda? Yeah? Okay. Open my kit here. I'm actually going to get rid of this so I don't break my sterile field accidentally. Just a little trash bag. We're going to need it. Okay. I'm going to open my catheter kit, pulling away from me. Be careful to only touch the edges. Minding the 1-inch border. Take these gloves, only touching the gloves. And I'm just going to step out to put on my gloves. I like to put on my gloves away from everything else. I'm actually going to be using these bigger gloves that fit me better. Okay, same thing here. Being super careful not to break sterile field, only touching the sides. Opening my gloves. Okay. First one. Only touching the cuff. And then I'm going to go under the cuff in second hand. I'm just going to fix this cuff. Okay. Now I'm going to come over. I'm only going to touch one side of this. This is just a drape to go underneath my patient. Be careful not to touch anything. Keep my sterile field. Okay. All right, I'm still minding my 1-inch border. I'm just gonna get everything set up here. The first thing that I'm gonna do is I'm going to lube. I'm gonna put lube on the end of my catheter. I just want to make sure that this doesn't fall around. Let's open my lube first. And I'm going to lube 2 to 3 inches of my catheter. Okay, perfect. I'm just going to set that right back in there. Not touching the sides. And I'm going to just attach my flush really quick. For the bubble. And then these are my cleansing wipes. I'm just gonna get these ready. Okay, I'm gonna move this over to my patient. Okay, and now what I'm gonna do is I'm gonna spread the labia and do one side top to bottom. Throw the swab away. Same with the other side, top to bottom. Swab away. And then right down the middle, top to bottom, throw the swab away. Okay, now I'm going to take the end of my catheter, insert it to the urethra, 2 to 3 inches. And then I'm gonna go just a little bit more just to ensure that I'm in the right spot. And now I'm just gonna hold on to that and inflate my bubble, 10 milliliters. Okay, I'm only gonna do 5 where this is a smaller patient and an older bubble. I'm just gonna double check to ensure, yep, the catheter is in place and it will not be going anywhere. We are good. And now what I'm gonna do is I am just going to take this out and set it up right here on the side of the bed, not anywhere where the bed will move, on a stable part of the bed. And now I do not have to be sterile anymore. And then this is where I would collect my sterile specimen. We do not have to do that today, but it would be labeled and sent to the lab. But what I am going to do is I am going to grab my cath strap and I am going to attach my catheter to my patient. And I would use some skin prep, but where this is a mannequin, I'm not gonna do that today. And I'm just going to attach it right here at the hub. Just like that, and it would be stuck to the leg with a little bit of slack right there. But where it is on a mannequin, we're not gonna stick it to the leg. The next thing I'm gonna do is I'm just gonna clean up my area. Let's see here. It would be stuck to the leg and it would not have this problem, but we're not gonna do that today on a mannequin. I'm gonna take off my gloves because I might have used some cleaner with iodine and I do not want to get iodine all over, so I'm gonna put on some different gloves and clean up my area. Maybe I can get my gloves on. Hands are a little bit sweaty. Are you still doing okay, Glenda? Yeah? Okay. See, it's not too bad, right? A little bit uncomfortable at first, I know, but it will help, okay? I'm just gonna clean up all of this around you. We're gonna leave the chunk underneath you just in case, okay? Let's get your legs all straightened out. Okay, and we'll get you all comfortable again. Then I'm gonna return you to a comfortable position. I'm gonna lower your bed. And there's nothing, your catheter is intact, everything looks great. You don't have any other cords or hoses. Your call light is right here within reach. You have all your personal items. Glenda, is there anything else that I can do for you today? No? Okay, I'm gonna come back in just a little bit and check on you, make sure that catheter is still draining okay. But if you have any questions, please let me know. And now I'm just gonna clean up my area, and then I am gonna go document all of my findings and all of my procedures in DocuCare.